Welcome back to the Sahara Podcast. As always, my name is Eliya Rizvi, and I will be your host on this episode. Today, we have a very special guest. He's a doctor that specializes in foot care or podiatry. So without further ado, let's introduce you to our guest speaker for today's podcast.
Hey everyone, my name is Dr. Mahmood. I'm a board-certified podiatrist specializing in foot and ankle surgery, as well as all ailments of the foot and ankle. Been practicing for just a little under 10 years. We have multiple locations across Indiana and right here in Lombard.
Well, thank you so much for coming out and answering these questions for us on this episode. So to start off, I would like to ask, what exactly is foot care and why is it something that is important?
Well, thank you so much for having me. So I think that's a really broad question. Foot care is anything that leads to pain or misalignment or can lead to malfunction of the lower extremity. So anything that falls within the realm of that, I would call foot care.
Okay. And then why is it specifically important for those that are over the age of 60? Because the clients that we serve are over that age range.
Yeah, so generally what happens is there's a few things. Number one, arthritis is not really a disease. Everybody gets it. The longer you live, the more arthritic change you will have. And this can lead to certain, let's call it disabilities, not necessarily disabilities, let's call it difficulties in movement, moving up and down, squatting, sitting, things that we take for granted right now. As we grow older, you'll start feeling them a little bit more. And so those things become a little bit more nuanced and something that we need to care about more as we age. Secondly, I think that there is other shear forces that end up coming through the lower extremity. And so when you're walking, you're constantly putting weight through the bottom of your foot. And the more you walk, the more wear and tear you put in through your lower extremity. And so you lose the fat pad on the bottom of your foot. Oftentimes you have, inflammation that develops in areas that, generally wasn't there previously. And so people that are generally older feel these more. Now, it's not across the board. It's not a generic statement. It's very specific to the patient. But generally speaking, this is what we see in our older population.
Okay. And that's interesting, like how you mentioned that arthritis is something that everyone gets. It's not just like an illness that you can get all of a sudden. It's something that's part of aging in a way.
Yeah, absolutely. So, think about our body as a machine. It actually is a machine. It's the most efficient machine, and it's meant to function optimally. So, for example, our entire our heart and our cardiovascular system is an internally closed plumbing system, and so if we eat unhealthy, we clog that system and we cause it to function more inefficiently, and so we end up with things like congestive heart failure, heart disease, et cetera, et cetera. And so, similarly, our musculoskeletal system it functions exactly the same way. There's an optimal function that needs to happen, and when we don't function optimally, which most people don't, they're not really taking care of themselves and wearing the right shoes or exercising the right way, and they end up developing these types of ailments because you get, collapse or abnormal ground reactive forces that come through and cause like knee problems, hip problems, and ankle problems as well.
Yeah, and kind of going off of that, I feel like, well, for me personally, I would say that what I've noticed is that, foot care is kind of like the last thing that people think about. Like, you'll hear people focusing on and warning you about like heart conditions and like diabetes and like even Alzheimer's, dementia, and like even hip and knee stuff, but you don't really hear focus on feet. Like it's something that you don't think about, but it is very important, as you mentioned.
Yeah, I mean, feet are not really glamorous. And so, we really don't focus on them, but they're our foundation. And if we don't take care of them, you end up developing all the issues that you talked about. If you have bad feet, you can't exercise normally. You're going to have bad cardiac health. Your lungs are not going to function properly, and you'll get arthritis in your hips and your knees. It's critical. Foot and ankle function is absolutely critical to maintain all the other things. Now, the reason I would say that that's probably the situation is because most people see, cardiac conditions, liver function, liver issues, kidney issues as life-threatening issues. Now, and they certainly are. They can develop into very serious conditions. And the vast majority of issues in the lower extremity that need downwards are not really life-threatening.
Right.
And so because of that, we kind of put them by the wayside and say, hey, we'll address that when it becomes a problem. You're not thinking proactively to address those issues before they become a problem.
Right. So one of the most common problems that we see with our clients and in general with people that as they age is diabetes. So does diabetes have an effect on foot care, and what does that look like?
Yeah, that's a fantastic question. Diabetes by and large is a systemic problem. One of my professors from back in school used to say, if you understand diabetes, you understand medicine. The way diabetes affects every part of your body is so profound that it kind of plays a role in every aspect. Cardiovascular risks related to diabetes go up when you have uncontrolled diabetes. If you have uncontrolled diabetes, it affects your liver and your kidneys as well. And all these things play a role in what happens in the lower extremity. Now, just like we talked about earlier, that people neglect what happens in their feet, when you have diabetes, you've just increased the level of problems that you're going to have in that lower extremity. And essentially, it can lead to much worse problems. So one of the most common things that happens, and to be honest with you, I see this in controlled diabetics as well as uncontrolled diabetics, that you get nerve damage, which we call peripheral neuropathy. Now, I know that's a wastebasket term. There's a lot of nuance to that. But that being said, there is a lot of things that happen to the nerves because of diabetes in the lower extremity. Now, when you talk about that downstream, what else happens? You have loss of protective sensation, which is kind of like the fine touch skill, fine touch ability that we have in the lower extremity. Sometimes you lose muscle function in terms of the intrinsic muscles of the foot. It's a very common thing that we see. It's called intrinsic minus, where the muscles of the lower extremity, the muscles inside the foot, start to atrophy because they don't have the appropriate nerve supply, and that can lead to actual deformity in the foot. It can cause simple things like hammer toes or bunions, and it can also lead to something called Charcot-neuroarthropathy, which is a very serious condition where you have collapse of a particular joint or bones in the foot. Which can really be the high end of manifestation, the real problematic stuff that can occur in the lower extremity. And I see it all in terms of what happens with very well controlled diabetics who are controlled right off the bat, and then they just get mild manifestations all throughout. And then also people who completely neglect their diabetes and end up with amputations and limb loss. And so that's the real concern, is that you have this systemic problem that can cause a small problem in the lower extremity, like an ulcer, like a callus, that can become infected and ultimately lead to an amputation. And nobody wants to lose a part of their body. And so that's where the real critical concern comes in with regards to diabetes in the lower extremity.
So what other conditions or illnesses such as diabetes can have an effect on a client's feet? Like, for example, our home care aides that are with them constantly, they are made aware of any health complications that our clients might have. So is there any specific health complications that if a client has, a caregiver should pay closer attention to their feet because of, such as with diabetes?
Yeah, so I think right on par with diabetes is peripheral vascular disease.
Okay.
Now, there's a multitude of levels of what peripheral vascular disease actually means. And, it's kind of a term where we talk about the arterial supply to the lower extremity as well as the venous supply. So both, venous problems, vein issues can be considered, fall into the category of peripheral vascular disease, as well as arterial issues. Now, certainly arterial issues are way more important, way more impactive on a patient's life than the venous issues. So let's break it down. Let's talk about some vein-related issues, which I'm sure your caregivers see all the time, and then we'll talk about some arterial issues as well. Okay. So typically, what happens is that if let's say you have a person who worked in a factory their entire life and they're standing on concrete floors, they end up developing varicose veins, varicosities in the lower extremities. Now, they can be superficial and deep. All those, it's the same system, so they both have that type of issue, and you end up dealing with leg swelling. Now, something as simple as leg swelling could just be leg swelling, which you have to compress and elevate to evacuate that swelling, or it could be something that could be causing skin tears. There's this thing called venous insufficiency dermatitis or venous stasis dermatitis, which can cause skin changes and thickening of the skin, which makes it difficult for people to actually take care of them. It can definitely have a lifestyle impact, an impact on their lifestyle as well, because oftentimes they can develop skin tears or venous insufficiency ulcers, which can smell really bad. They drain and they're very painful, especially if these people are not diabetic and they're not neuropathic. So on the venous side, that's something that I would say, is something that your caregiver should definitely be aware of, and in the general population as well. Now, on the arterial side, this is something that happens very commonly with diabetics. Diabetics get something called intimal calcifications, which is like thickening of the vessels of their lower extremity. As a matter of fact, if you take an X-ray of a diabetic, oftentimes you can see little squiggly worms all throughout the X-ray, which is calcified arteries all throughout their foot and their leg. And so two things can happen. Either you can have, very thick calcifications in your arteries, which prevents them from contracting. There's a muscle layer inside our arteries which contracts and relaxes and allows blood flow to have a normal stasis, a normal flow throughout our cardiovascular system. And now if you calcify, then it becomes very difficult for your body to do that. And so you don't have good circulatory issues if you have non-compressible vessels. And then on the other hand, you can have weakening of that intimal layer. You can have loss of the muscle layer inside those arteries. You can have lessening of those arteries through whether it's plaque formation, atherosclerosis, so many other things that are which we kind of correlate to cardiovascular issues, which can happen in the lower extremity as well. Now, what happens in those situations is you get loss of blood flow to the lower extremity, which is a very serious issue. If you develop a wound, you bump, some very simple things like if your toenail starts to come off, instead of having the ability to heal, it becomes gangrenous because there's no blood flow. You can't grow grass without water. You got to have blood flow to any part of your body in order for it to heal. And so it's a very critical thing. And that's what I would say is another really major issue that would be affecting the Asian population. Diabetics, smokers is also, they're at risk for developing these types of issues. So things to kind of keep a lookout for when they're visiting their patients.
Okay, so I know you mentioned like varicose veins and those types of things. So just to clarify, are those things that would be visible to the caregiver also, like in their client's legs and their feet? Like what's something that they should, if they notice, they should point out to the client, maybe to the client's family, so that they are properly getting that checked out by their doctor? Yeah,
absolutely. So very simply, if someone complains of swelling in their legs, that's something that can easily be looked out for.
Okay.
And just swelling by itself is definitely a telltale sign of something going on in the lower extremity. It can also be a telltale sign of what's going on in the heart. A very common finding with congestive heart failure is that you get swelling in your legs.
Okay.
And so the other things that your providers can actually look for is that there's something called pitting edema, which is like swelling in the leg. When you press it, the indent of your thumb or the finger that you put in there actually stays in there. These are signs that there's more advanced issues that are going on. Other things that you can look for, I could mention venous stasis dermatitis. It's like thickening of the skin, dark splotchy areas in the skin that could be indicative of some kind of venous issue. Just coolness of the skin could also be something that would be related to that as well. And then lastly, the easiest thing to look for is actually just varicose veins, and that's something that we're pretty vain, and so we always look out for any kind of anything that might look unsightly. And so looking at things in the lower extremity that might have spider veins, dark blue discoloration around the ankles and the top of the foot, sometimes in the leg as well. These are all things that can easily be looked out for.
Okay. And then I just want to make sure that I point out to those of you that are watching that are caregivers, we're talking about a lot of medical conditions and things that your clients may be facing. But once again, as a home care aide, we're non-medical personnel. So in the case where if you notice something off about your client, or, if you are noticing the like varicose veins or something, or if your client is telling you that they're having swelling in their feet, it's very important to let your supervisor know of this so that we can properly document it to their case manager. And the best that you can do is, always push your clients to constantly follow up with their primary care provider and bring up these, issues with them and make sure that they're getting addressed.
Yeah, I think that's a very great point that you bring up. Oftentimes, even just bringing it up to the primary care doctor isn't enough. Sometimes, if you get a specialist like myself on board,
Yes.
it really helps facilitate that care. Primary cares don't have the bandwidth to go and individually compress and create wound care orders and actually do the physical care. Certainly, you can have therapists like lymphedema therapists, etc., that go out and actually do the therapy and help them evacuate the swelling in their lower legs. But to create those treatment protocols often comes from specialists. It doesn't come from the primary care. Not to say that they're not capable, but they have so much on their plate. You go to a primary care doctor and you're like, yeah, my head is hurting, my nose is bleeding, I have a itchy and scratchy throat, and my stomach is bothering me. Oh yeah, I also have diabetes, which is uncontrolled. My A1C is 9. They're just like, oh my God, what is going on here? All right, let's go. Yeah, one at a time. And so, that's where the role of specialists really comes in, is that, you have somebody who's an expert in only one particular thing, and that really helps facilitate good care.
Exactly. And then for those of you that do reside in Lombard, their clinic is in Lombard. We have information about their clinic. We have pamphlets. We have a binder with a lot of information and helpful tips. So please be sure to reach out to your supervisor for more information on how you can get in contact with a specialist so that you're taking care of these things before they become a bigger issue. And that goes for our clients as well as our caregivers, So kind of bandwagging off of what we were just talking about, let's shift our focus to our caregivers. Foot care is obviously important for them as well, not just for those that are aging. Correct me if I'm wrong.
Yeah, absolutely.
Yeah. So, we want to encourage our caregivers also to be mindful about their feet and, pay attention to these signs as we're discussing throughout this podcast, and, just become proactive in your care, because you cannot take care of your client unless you are healthy yourself. So we also think it's very important for our caregivers to take care of themselves as much as it's important for our clients to be caring for themselves.
Yeah. So just a point of support.
Yes.
My practice is called Momentum Foot and Ankle Clinic. We do have a home care arm of Momentum Foot and Ankle Clinic, and we cover pretty much all of the Chicagoland area as well as some of Northwest Indiana. So if there's ever any need, we can send providers out to take care of them in their home as well, especially if they don't have the ability to transport or they're not local to our office.
Yeah, no, that's great information. So anyone from any of our 12 locations could reach out and find out and have someone come to their home directly for foot care. That's incredible. So now I want to ask you a little bit about wound care. Specifically, what are some signs that a wound is becoming serious? So what should our caregivers look for in themselves and in their clients if there's a wound or a sore? When can they find out if that is becoming serious?
I think the simple fact that a wound is present makes it serious.
Okay.
And so anytime, especially in a population that is aged, or they have, medical compromise, any at-risk population, I would say even something as simple as skin tears are definitely important and need to be looked at.
Yeah.
There's a sentiment, actually this is very well documented, that if a wound is open for longer than 2 weeks, they don't talk about depth, they just say any wound that is open longer than 2 weeks is now considered clinically infected. And so oftentimes, these patients, especially diabetics, they don't feel the wound that they have, whether it's on their legs, their foot, the base of their heel. And by the time it becomes clinically infected and the caregiver comes in and says, hey, what's that smell? They take the sock off or they take the shoe off, and they're like, "Oh my God, you have maggots growing." And I've seen this personally. It's something that can definitely be a problem. So I think in terms of wound care, anybody who's anybody in the at-risk population that has a wound, I would take very, very seriously.
Okay.
It also leads to difficulties in healing, whether it's diabetes, whether it's peripheral vascular disease, venous or arterial, all these things, they play a role in healing. And if you don't have those faculties to allow healing, then the wounds stay open a little bit longer.
Oh, okay. That's interesting. What would be some tips for our caregivers on, managing that wound? If they do see a wound is there, what is some things that they can do to help with that? Obviously non-medically, because they're not medical personnel, but until they can get that checked out, what's something that they can do to help prevent it from becoming further infected or getting worse before?
Yeah. So the simple things that can be done are cleaning it, get some saline, clean the wound, apply a bandage over it. Generally speaking, you don't want to leave anything open to air. You want to cover it puts an ointment on it. Our go-to has been bacitracin, and I think that that's something that we need to stop doing. Bacitracin is really for, a young person who falls off their bike and scuffs their knee, not really for anybody who is at risk, or anybody, even if they're not at risk and they develop some kind of issues, they should really get something a little more serious. The different antiseptics and stuff like that can be used, A&D ointment, mupirocin, and these are available over the counter as well. They don't necessarily have to be prescribed. So things like that is what I would recommend doing. And then, of course, the most important thing is that if you're concerned about it, get an expert involved, get somebody involved, and have them take a look at it, and get some recommendations on what can be done long term to make sure that this person doesn't have any long term implications from that ulcer, from the wound.
And when would you say should a caregiver clean and dress a wound at home versus when should they seek medical attention right away?
That's a great question. So very simply, we look for clinical signs of infection: redness, swelling, drainage. That's anything local. If you have any redness surrounding a wound, consider it infected. And then if there's systemic signs, if you see a wound and somebody's like, hey, I've been nauseous for the past 3 days, nausea, vomiting, fever, chills. These are all systemic signs of infection. Oftentimes if someone calls the office and says, hey, I have a wound and I have nausea, vomiting, fever, chills, I say, hey, go to the hospital. It's not something that even the acuity of the clinic should handle. It should be something that, goes to the hospital, and the ER gets started an IV antibiotic. So that, I would say, if your providers are seeing, redness surrounding the area, or if there's any foul odor, any drainage, those are things that should put them on high alert.
Okay. And then again, for our home care aides, if you're ever concerned about what to do, confused, your first role of action should be reaching out to your supervisor for further assistance on what to do. That's case specific for each individual case, each individual client. It's better to reach out and find out exactly what to do than to try to make a judgment call, which could, end up not being in the client's favor. Okay. What would be like a sample routine that our caregivers could follow for monitoring, whether that's daily or weekly?
So I think on a daily basis, as long as there are wound care orders in place, if the wound has already been established, that's totally fine. They can do the daily dressing changes for the patient. But in terms of weekly things, what they can do is really do general skin evaluations, look at areas of pressure, the back of the elbows, the shoulders, the base of the spine, around the hips, and the base of the heel. These are all like really critical areas that can lead to pressure sores, and very simple things like just making sure they're offloaded and there's no pressure on them for any extended period of time can prevent the pressure sores from developing. And then when it comes to diabetics, looking at the ends of their toes, make sure that there's nothing inside their shoes. These are all very simple, things that can be looked at that don't really require, medical training in terms of doing these assessments. Just look at it and see if there's any areas of concern, and that can certainly help the patient and go a long way for them.
What would you say is the best way for our caregivers to communicate concerns about foot care for their clients to the client's family? How can they push a client's family to kind of take it seriously, or how can they address feet concerns that they might have?
That's a good question. I'm not really. I've never dealt with the situation where if you told a family member something concerning and they said, it's probably nothing. Yeah. But it said, usually if one of the caregivers is concerned, or if the patient is concerned, then the family would also be concerned. Yeah. But, things that you can kind of say is that, hey, there's a high risk. Like, for example, let's say we're talking about a person with peripheral vascular disease or diabetes, and they have some odd redness, let's say around one of their toenails, or their toenails are becoming really thick and starting to fall off. Relay that to the family, saying that, based on our experience and what our training tells us, is that this can lead to very serious problems, up to the point where they can lose the toe. And so I think that it'd be very important for you to follow up with the primary care doctor to at least figure out if there's something they can do, or if they can get a referral to a specialist to have them take a look at it.
So what would you say are the biggest mistakes that you've seen in terms of diabetic wound care?
So I think the biggest thing is just creating awareness. When you see something and you play it off as not being important, that's the biggest problem that can that can potentially come out of the interaction with the patient. If there is anything that arises, as something as simple as a callus that has weird discoloration to it, that can lead to serious issues. So I think that the biggest thing is taking things too lightly, especially in at-risk populations.
So, a lot of our clients are bedridden, or they're, immobile. They're not able to move around on their own or much at all, really. So, how does that affect their foot care? Are they more prone to having more issues with their feet since they're not using them as much? And then what can they do to prevent, further complications in their feet?
Yeah, so I think simple things, patients, clients that are immobile, like I talked about earlier with pressure sores, that's probably the biggest thing, because that happens with anybody across the board. You don't have to be diabetic or a compromised patient. If you sit in one place, if a young person who's very healthy puts their foot on a hard surface and leaves it there long enough, you'll get ischemia of that area from having that pressure on there. So, doing skin checks and constantly checking on those pressure spots is very critical. I think that's probably the main thing that I would tell providers to take away, any of the caregivers to take away from that, is that, check their pressure spots to make sure that they're not developing any issues. This is a standard thing that we do in hospitals. It's a standard thing that we do in clinics with our high-risk patients. And so, as a matter of fact, even for patients that are not bedridden, when they're in the hospital for long periods of time, they have skin checks that happen so that to make sure that they don't develop those pressure sores. So that's what I would say is definitely an important thing that they can do.
To close off this episode, do you have any advice for our caregivers or for our clients in terms of foot care and taking care of their feet? What's the best advice?
I think the best advice is that if you see something and you're concerned, bring it to someone's attention. That's the simplest thing and the best thing that you can do. Oftentimes things lead to problems, as I previously stated, when we let them go by the wayside, when we don't give them the appropriate importance, and something may seem very small and then it turns into something much bigger later. So I think the best thing is that the best advice that I can give is that if you're concerned, we're concerned, relay that information to your supervisor, to the primary care doctor, if you have direct communication with them, or any of the specialists that are involved.
And thank you once again for coming and talking to us about this topic. And thank you to everyone that tuned into this episode and listened. Once again, we will have information about their clinic and services that they provide for our clients and for our caregivers at our offices. So be sure to reach out to your supervisor if you're concerned or if you want more information. I'll put some information in the description below too on how you can contact them for your foot needs. And thank you once again, and we'll see you in our next episode.